Hey everybody, I know it's been a couple weeks since I've done a video. I think, check my calendar. I think I'm like day 8 or 9 past my second chemo. Let's see, today is Sunday. Oh, today is day 11. Okay, so I'm halfway through my second cycle or infusion of my Taxotere for the progression in the lymph nodes and such. But one of the things I've also noticed through my treatments without chemo, with the H&P, is the diarrhea, and I've noticed that with the chemo, that I also started getting more diarrhea, but which is understandable, but more muscle cramping, and I'm like, what's going on here? And I it took me a long time to really kind of try to process it because the chemo brain starts kicking in, and just trying to put thoughts together in a logical manner can get really difficult. So when you're undergoing any cancer treatment, there's something called tumor lysis syndrome. Now, I'm not saying I have that, but what happens in tumor lysis syndrome is when you get your infusion of whatever chemo it is you're taking, and you have a lot of tumors and they all start dying really fast, your body gets overwhelmed with electrolytes such as potassium, phosphorus, and your calcium levels plummet. But your potassium and phosphorus levels go up really high, and that can cause other kinds of heart problems and such. So, I'm thinking, well, I don't have tumor lysis syndrome, but we all go through, some degree of tumor lysis, where the tumors are dying and releasing their cell contents and kind of throwing off the electrolyte balance in the body. And your body, of course, finds a way to adjust for that. But there's other things going on too. So when you're doing chemo, a lot of us are on dexamethasone or Decagon, which is it's a steroid. I can't say the words with the C. It's just, it's too long for me, especially right now with my brain. But what I have found that dexamethasone, it also, when you're taking it for an extended period of time, and if you're doing chemo over and over and over and over again, you're taking a lot of dexamethasone, and it takes time to get out of your system. And if you're taking the Taxotere weekly, it's not ever out of your system. So you are on steroids for months, and that can definitely affect your B6, vitamin C, vitamin K, zinc, magnesium levels. Now, if your magnesium levels get low, it can also affect your calcium levels, which is also a problem with the tumor lysis syndrome. So here's the thing. I've been on steroids for over a year now, for not only my cancer, but because of my autoimmune disease. And I noticed my last 2 cycles, like this last cycle in particular for the chemo, I've been having a lot of spasms in my back, in my legs, in my hands, and I'm like, what is going on? And I thought it was just the magnesium, because my magnesium levels are on the low end of normal. And that's when they test you, that's right before you get treated, because your bodies have time to recover. But that doesn't mean 2 days after that my magnesium levels have plummeted, along with the calcium levels may have plummeted because of the tumor lysis that's going on and the dexamethasone that is currently at the high dose at that time. So, but then I started reading more and learning more, and I said, wait, the calcium levels. And I realized that I haven't been taking a lot of calcium because milk and diarrhea don't get along. So I'm like, oh, shoot. So I went in and I checked my calcium levels, and of course they only check them once every 3 weeks, and I don't check them in the middle of when your body is going through all this chemical hell. But my serum levels are usually good. But you have to remember, your body, if it senses low calcium levels, what it's going to do is going to pull the calcium from your bones to keep that level of serum calcium where it needs to be so things can function. But I don't know the details, but I'm sure there's got to be some kind of lag time between sensing a low and being able to bring it back up. And I think that during the first week to week and a half after my treatments is when the things get really screwed up, and we're not testing my blood at that time, so we don't really know what's going on in there. But it seems reasonable to believe that maybe during that week to week and a half after my infusions, that my calcium levels are dropping too much. And same thing with my magnesium, which are contributing to the number of muscle spasms in my hands. So like they'll like roll over like this and like get really hard. Same thing with my legs and my back. It's like almost constantly having some kind of spasm, as long as some my abdominal muscles. So it's something to be aware of. And I've been trying to figure out, because the spasms could also be affecting the diarrhea. Because, we all been told if you eat calcium, or excuse me, magnesium, it might make you poop. Well, but it's kind of a relaxer. And those of us who have chemo-induced diarrhea, what we're experiencing is not over relaxed intestines, it's over hyper or hypomobility of the intestines, where things are just going, blah, 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 blah. They're going way too fast, or just shooting through. And that's why we get so weak and tired, and there's so much acid in there, because it's just things are not digesting at all, and they're going through way too fast, so they're not digesting and they're not being absorbed. So the combination of diarrhea, and then you have the tumor lysis, and then you have the dexamethasone, your calcium and magnesium levels are getting hammered. I mean, the diarrhea itself can make you have problems with your magnesium. And then you add on the dexamethasone, and the tumor lysis doesn't do so much for it, but the dexamethasone definitely does. And to top it off, if you have any kind of a GERD and you are on a proton pump inhibitor, guess what? It can also affect your magnesium levels too. And guess what? I've been on that for a while. So my magnesium and calcium levels are probably just going. And so what I've been trying to do, and with the advice of one of my doctors, is she said to buy some magnesium oil, because we know magnesium is going to be low in us when we're doing chemo. That's kind of almost a guarantee. Eventually, if we can't get enough magnesium absorbed because of diarrhea or what have you, we're going to be low. And so this is a spray, and you spray it on, and you leave it on. But I tend to spray it on 20 to 30 minutes before a shower, because it's kind of sticky a little bit. But you leave it on, and then you take a shower, you wash it off, and it absorbs through the skin. And it's been known to, it's been around for a long time. So this is hot. I'm not sure what's going on there. But so magnesium. Another thing is calcium supplements, and I feel that for me a chewable one would be wise, because if I'm having quick diarrhea, I want something that's going to be quickly absorbed, and a pill will not be quickly absorbed. I want something that's going to be already into a liquid state when it reaches my intestines, so that maybe some of it might get in before it got shot out. So maybe this will help you feel better sooner. But I have noticed that since I've started using the magnesium spray, the muscle spasms have decreased or not gone. But I think it's because my calcium levels are still struggling to maintain their proper levels. Eventually, by the time I go get my blood tested in a week and a half, it'll probably be back to normal, because all the things will have settled out. But in the meantime, all this is, kind of body's fighting to find that homeostasis, and it's been having problems. But overall, this last couple of days, I've been feeling so much better. The diarrhea did come back today, but it's manageable. It's just, I've started to take the Lomotil again. I think it's because I had some fatty meat. It was really good. My daughter made some ribs, and it was good, but my tummy went, maybe not so good. So maybe too much fat, too spices, but I don't care. It was good. It was worth the diarrhea. You got to enjoy life a little bit, even if it has a cost to it, right? But anyway, something to keep in mind. If you're going through chemo and you're having muscle spasms, think about magnesium and calcium. So maybe if you don't want to worry about adding diarrhea to it, maybe take, instead of a magnesium oral supplement, maybe do a spray that you can spray onto your skin. And for the calcium, just, a chewable one, I would say for me, a chewable is better, because I know things are going through too fast, and the pill may not be broken down fast enough to be absorbed. So I would say that. And then, another thing that you would think, oh, I'm taking a multivitamin. I do this one. So it's women's gummies, or and there are things like I don't want to do pills. But I looked at it and I'm like, oh, I got calcium in here, right? I'm getting 8% of my daily recommended value, with is it 2 gummies? So I was only getting 8% with this, and then not drinking milk because it's supposed to make the diarrhea worse. I do a little bit of coffee creamer, half and half, and also some yogurt. But cheeses don't work with me right now still. So a very limited amount of calcium intake. So there's another thing. So to be aware of. Calcium, magnesium, especially in the first 2 weeks of your chemo. And also, if you're on the dexamethasone, be aware of B6, because it can deplenish that. And now one thing I've noticed with B6 is that when I take my B6, the angular cheilitis, the cracked corners, they get better. When I stop taking the B6, they come back. Now, so you can think of that as the tissues are just getting too thin and they're easily irritated and cracked. And you can kind of think of that as your whole digestive tract is kind of feeling the same way, and your mouth. And so if you keep your vitamin B6 up, vitamin C, is an antioxidant, so you have to, think carefully about how you want to use that during your chemo, because not all chemos and antioxidants are a good idea together. So be careful with that. But zinc is another, I think it's a mineral, and it's important for your immune system, but I don't think it's an antioxidant, but don't quote me on that. And then, of course, vitamin K, which is another, I think it's for blood clotting, but again, I haven't really spent a lot of time on that. So anyway, if you're on a proton inhibitor, just be aware that it could also affect your magnesium levels. So I've been on it for like 5 weeks. I guess I should probably take a break. And hopefully things will kind of start calming down intestinally and muscle-wise, and I can start, being normal. I feel actually pretty good. The last 2 days, I felt pretty good. Today I felt almost completely normal. A little bit of shakiness, a little bit of fatigue, but geez, I'm only halfway through my cycle, so that is completely acceptable. But so I hope this has been helpful. So if you're going through chemo and you're having muscle spasms and you're feeling really weak and shaky and other things, think about magnesium and calcium. And if you think you might be deficient, if you're taking dexamethasone, it's a possibility that it can contribute to it after a certain amount of time. It's not like immediately. I think they said it was a number of weeks. If you take it for a number of weeks in a row, it can start affecting your levels. Well, or other corticoids, steroids, that is. Like I take prednisone, so I take prednisone and I take dexamethasone, so I'm on too. So I'm definitely at risk for magnesium deficiency because of that alone. But just be aware of that, sometimes our doctors may not always think about that, and everybody's situation is different. My doctor doesn't really think of, my oncologist doesn't really think about what my rheumatologist has put me on, even though I'm sure they're aware of it, but they don't always think of the nutritional implications. They think more about the diarrhea and, make sure the patient can stay on the medication. They don't think about all the nuances all the time. Not to say no doctors do that, but doctors have a lot going on. So, I hope that was helpful, and I hope you feel good. And I know we all have bad days sometimes, and we kind of sometimes want to give up because cancer sucks, but our whole thing is just to go out there and enjoy life and share happiness with other people, and just be a part of society. Do whatever you can, even if it's just using your mind and sharing your thoughts. Even if your body doesn't want to function anymore. Think of oh my gosh, I can't think of his name, is for the scientist who was wheelchair bound, Stephen Hawking. His body was completely useless for him, but he still contributed a great deal to science through being able to talk through the computer. So just because your body may not be wanting to cooperate for whatever reason, if your mind is still there, use it. Whatever you got, use it, enjoy it, share it, get the most out of every day here, because once we're gone, we're gone. All right, guys. Take care of yourself, and I hope you're having a great day. It's Pi Day today, by the way, so happy Pi Day, 3.14. All right, guys, bye-bye.